Hola, hola, it's JW or Jenna W. Clark, Doctor of Pharmacy and Advanced Fellow of Anti-Aging, Metabolic, and Functional Medicine, here to tell you a little bit about how much your hormones have to do with your actual health, the way that you show up in the world, and the way that you metabolize with the environment around you. And I think it cannot be understated how much impact that has because your hormones are the messages that you are receiving from the perception that you are receiving from your environmental inputs, which you are choosing based on those responses. So, to begin really giving yourself a balance and a metabolic advantage so that you can have optimal functioning with minimal damage, we can look at what's going on within your hormonal messaging system and optimize that communication so that we can begin to create an environment internally and then externally and then internally and externally that creates that feedback consistently. Now we know that as we age, we lose our hormones, but what we've discovered is as we lose our hormones, we age. And that's really what anti aging, regenerative, functional, metabolic medicine is looking at, is we're looking at what are the causes of damage that outdo the repair that we're able to do. And we see a lot of this is related to a decline of hormonal balance and hormonal supply. And as that ability to respond, to adapt, to create communications in our body deteriorates, then of course our health and wellness deteriorate alongside. Some of this is part of a natural cyclical pattern, and a lot of it has been sped up, changed, and put in a really new perspective as we're able to utilize some scientific observations to move forward. So, without further delay, I'd like to talk to you a little bit about some of the major hormones, the ones that we'll be testing within this package that allow us to have a better control, a better view, a better perspective, and some more insight into what's going on within our own bodies. So, estrogen, estrogen, estrogen. There are lots of different types of estrogens, over 60 structures and 60 that we definitely know of. We typically are only looking at one type of estrogen when we've been studying this in medicine and in functional medicine. And the way that we are looking at this in regenerative studies is we're also looking at two other major estrogens. So we're looking at estrone, estradiol, and estriol, and we'll get into the differences between those three majors. But the reason that I tell you this is that estrogen is one of the oldest molecules that's been found in coral reefs, right? And it's a communication molecule, it's an adaptability molecule, it's a motivation molecule. There's all these great things. And what I mean by that is it protects against osteoporosis by delivering blood to the smallest vessels. It protects against heart disease, it protects against memory loss, it protects against colon cancer, incontinence, and tooth loss. And the reason it does all of those things is the adaptability to the smallest blood vessels and the availability to respond to the receptor call for that adaptability to open and close very small. So that's where the osteoporosis, the bones, the teeth, the brain, the colon, those are very small arterioles. It's very small points of delivery that need to be able to open and close and to be responsive, and estrogen helps them do that. It also enhances sleep, it enhances emotional well-being, mental acuity and focus, your memory, your attention span, the ability to communicate, your vision, hearing, touch, your small intestine health in general, your libido, because your sexual organs are extremities and they need a beneficial adaptability and blood flow as well. Skin tone, it also relieves menopausal symptoms and depression because that's when we see a lack of responsiveness to those receptors, and we are able to get a lot of data there. And it increases your tolerance to pain, your adaptability, right? Your ability to change those things moving forward, has hormonal responsiveness, right? Progesterone. Progesterone, make sure we're really being careful with the word progesterone. It is not progestin. It is not a progestin that you can just lump in there with a whole bunch of other molecules that look not really a lot like it at all. So progesterone is a natural molecule and it has a calming effect, enhances mood. This is the hormone that we do tend to lose with age and with stress and with adrenal fatigue. This can come down a lot sooner. Also comes down and has and kind of a dip after having a baby because we use a lot of this when we become pregnant. So progesterone is also present in males. So it's not that it's not there, and it has a lot to do with the conversion of testosterone into its negative metabolite, or what we call its negative metabolite, in both males and females. So it's something to think about there. So it has a calming effect. It enhances mood. Progesterone regulates fluid balance to make sure we're not getting too swollen. It works as a diuretic. So increases blood sugar and thyroid function and mineral balance. So the balance of your blood sugar, your thyroid balance, and your mineral balance, which for me, I've seen a lot of correlations here with progesterone, cortisol levels, and thyroid balance needing to work together to get into a really nice homeostatic rhythm. It relieves menopausal symptoms. It decreases the risk of endometrial cancer and may help to protect against breast cancer. More and more research there, as well as research on estrogen there, and fibrocystic breast disease. It protects against osteoporosis and heart disease. Remember, this is all about balance, and I can't wait to get into the balance of things. But your hormones are communications, and how well they are communicating is also in part due to how well they are playing into each other. It's almost like a song, a harmony, a music piece, where if one portion of the music is much too loud or a little off tune, it can throw everything else off. It's more about balance than one or the other. But as you can see, just talking about these two hormones out of the 5 we're talking about today, how much an impact your hormonal messengers have on your overall health, right? Testosterone. So testosterone, males and females, there's a lot of different little caveats to watch for in the differences between DHEA, testosterone, progesterone, and cortisol, and how those interplay in the processing of male and female and the amounts, but we all have them all. And it's important for us to remember those beneficial effects. That testosterone helps to build muscle and promote muscle tone. It increases energy and libido, a lot of sense of well-being. So it does enhance the sense of well-being, and it helps to strengthen bone. DHEA. DHEA is a precursor to testosterone, helps to level cortisol, turns over differently in men and women, so important to watch that. It helps to protect against heart disease, osteoporosis, diabetes, cancer, memory loss, lupus, and rheumatoid arthritis. Can increase and enhance energy level, libido, memory, and immunity. It protects against the effects of stress. So we're just talking about leveling with cortisol. It aids in weight loss and healing of burns and helps to prevent wrinkles and dry eyes. So cortisol, it helps in responding with coping in stress, trauma, infection. That's what we numerally say cortisol. And we initially kind of split the functional and traditional medicine routes on we're going to use acute care, we're going to use a big dose, and then we're going to have to taper down, and there's all these side effects. or on the more functional route, hey, we're going to look at the cortisol rhythm, and we're going to find out ways that we can optimize the cortisol rhythm for longevity. And we realize that our cortisol being able to respond at the time that it's necessary is the most important thing. So it does help in responding and coping with stress, trauma, and infection. It increases energy and metabolism. It helps to regulate your blood pressure. It's responsiveness, right? It enhances the integrity of your blood vessels and reduces allergic and inflammatory responses. So having all of these things interplay obviously has so much to do with your health and your wellness and your ability to prevent disease states, to prevent damage to your body, damage to your DNA, which we would know as cancers, damage to your quality of life and your functioning, so that we can optimally function by finding balance. And there's lots of ways we can do this, remembering that the reason hormones are so important is because they're the messenger systems throughout your body that's allowing that really the epigenetic functioning, right? The way that you are able to make the choices to create change within your body. And by finding out your hormone levels and looking at what's available to you so that you have a view, a perspective, a report card, a move forward, a point on your journey, a point on your map to move forward and really feel into understand that these are responses to the input and we can optimize them. It feels so good to know that. Let's look at these hormones in your test. I cannot wait. Estrogen, progesterone, testosterone, DHEA, and cortisol. Remembering that these are all they are all equally important, and nothing is as important as your willingness to feel and lean into the changes that we discover as we move forward, because these hormonal responses, when optimized, when balanced, will definitely allow you to optimize your metabolism, optimize your vitality, and optimize your longevity. So I'm so excited that we get to look at hormones as part of our overall health. And let's go ahead and move on to the next portion.